The blood script that you do is extensive, and I've gained quite a bit from it.
I appreciate that. I do much more thorough work than traditional doctors when you go to your family GP. Even my cardiologist said to me, he goes, you do a lot more work than I do as far as the blood work goes. But you want to look at ApoB as a carrier of LDL. It's a much more predictive risk factor for cardiovascular disease than just LDL. Like native LDL is of no value. So you need to look at particle size, particle number, and then you want to look at your inflammatory markers. And then there's a genetic risk factor around cardiovascular diseases known as Lp(a). And you can have normal cholesterol, but you can have a very high Lp(a), and that's more of a problem than having high cholesterol and a low Lp(a). So you want to look at these things as well as homocysteine, myeloperoxidase, high sensitivity C-reactive protein. And then what I've been doing with patients in the office is I've been measuring patients' nitric oxide levels. I can measure that in about 30 seconds. And then I will give you a beetroot extract and a fermented beetroot powder made by a company called Berkeley Life, and check your levels about 90 minutes, 2 hours later, and it's dramatically increased. And that it's increasing oxygenation to every single tissue and cell of your body. So for me now, at this age of 68, soon to be 69, I want oxygen into my skeletal muscles. I want my heart pumping good. I want blood going into my brain. So most people are low. Most people are low on nitric oxide, and it's an easy fix. And every chronic disease, from cancer, heart disease, has low nitric oxide levels associated with that. This is very important. Actually, Dr. Ignaro, Louis Ignaro, Furad Murad, and Conrad Murray all won a Nobel Prize for this in, I think, 1998 or 1996. And that led to 3 blockbuster drugs, Viagra, Cialis, and Levitra, all drugs around erectile dysfunction, which is truly endothelial dysfunction. And those drugs initially came out in the hypertensive arena, but because that arena was already so flooded with all these different medications, from beta blockers, ACE inhibitors, to angiotensin receptor blockers, to calcium channel blockers, that they decided to create a new class, which is erectile dysfunction. And so if you can do that same thing without taking the drug and really increase oxygen into your body, especially as you get older, that's a great thing.